Part 1. The science and technology. Deep inside every cell of your body is a library. This library contains the source code of life, DNA. 3 billion letters defining who you are. But sometimes there's a typo in the code. A single wrong letter can cause genetic disease. For decades, we could read this book, but rewriting it safely has been the holy grail. You have likely heard of CRISPR. Think of CRISPR as molecular scissors. CRISPR works by cutting the DNA strand in half. It creates a double-strand break. This triggers the cell's emergency alarms. The cell rushes to fix the break, but the repair is often messy. Errors can happen. It's like trying to fix a typo by ripping the page. Prime editing is different. It does not cut the DNA in half. Think of it as a search and replace word processor. It finds the exact spot using a guide RNA. Then it writes the correct genetic information. It only nicks one strand, keeping the helix stable. The result is greater than 90% precision, fewer off-target effects, safer for the patient. Their lead asset, PM359, uses this technology. It targets chronic granulomatous disease, CGD, phase 1/2. Data has shown proof of concept. Part 2, the financial reality. Great science does not always mean a smooth ride. The biotech market in 2025 is volatile. Prime Medicine stock has seen high volatility. Implied volatility is over 100%. Beta is over 2.6. This means it moves 2 to 3 times more than the general market. Why is the market nervous? It comes down to revenue versus cost. Q3 revenue was $1.23 million. This missed analyst expectations. Meanwhile, R&D costs are high. They burn approximately $50 million every quarter. This imbalance is what investors call the valley of death. Can they cross it before running out of cash? Fortunately, Prime has prepared for this. They hold $101 million in cash reserves. Crucially, they have zero debt. Their current ratio is 6.6 times. This means their assets cover their liabilities 6 times over. This liquidity buys them time to execute. Part 3, strategy and data. Prime Medicine is not fighting alone. They secured a strategic partnership with Bristol Myers Squibb. The deal value potential is $3.5 billion. This includes milestones and royalties. It provides capital without diluting shareholders. It also validates the technology platform. Regulation is the gatekeeper. The FDA has granted fast-track designation. This allows for more frequent meetings with the FDA. It accelerates the review process. It is a critical advantage in the race to market. Let's look at the analyst data. There is a wide divergence in price targets. This reflects the binary nature of biotechnology: high risk, high volatility, high potential. The science is rewriting the code of life. Whether the market follows depends on execution. Want the full breakdown? It's in the bio, the Analyst AI.